Let me share with you the scary truth about neuropathy and why a wait and see attitude is actually a very dangerous game. Are you living with a constant nagging burning in your feet? Do you wake up in the middle of the night feeling like someone is sticking pins and needles into your toes? Or perhaps you've noticed that you're stumbling more often, reaching for the furniture to steady yourself because you just can't quite feel the floor. If you're nodding your head yes, I want you to know that I hear you. At Aniana Neuropathy Center, we see people every single day who feel like their own body is working against them. It's frustrating, it's exhausting, and let's be honest, it's scary. But here's the truth that many people don't want to face. Neuropathy is a progressive disease. It doesn't just go away on its own. In fact, the most dangerous thing you can do for your health and your future independence is to adopt a wait and see attitude. Let me share with you why ignoring the tingling is a big mistake. When neuropathy starts, it might just be a little bit of numbness or weird tingling sensation. You may think, oh, I'm just getting older, or I must have just slept wrong on it. But inside your body, something much more serious is happening. Your peripheral nerves, the communication lines between your brain and your extremities, or your feet in many cases, are dying. Think about your nerves like electrical wiring in your home. If the wire starts to fray, the lights might flicker. If you ignore the flickering, eventually power goes out entirely. In your body, that power outage translates to a total loss of sensation. The scary part isn't just the pain, it's what happens when the pain stops. You can no longer feel your feet. You lose your proprioception. That's your brain's ability to know where your body is in space. That's why neuropathy is the leading cause of falls in the elderly. A simple trip to the kitchen can result in a broken hip, a hospital stay, and a permanent loss of independence. Let me share with you what many doctors won't tell you about managing pain. Most patients come to see us after they've already seen their primary care physician or a neurologist. Usually, they've been handed a prescription for gabapentin or Lyrica or some other nerve pain meds. Now, I'm not saying the medications don't have a place, but here's what your doctor might not tell you. Those drugs do absolutely nothing to heal the nerve. They are essentially chemical masks. They turn down the volume of the pain signals reaching your brain. But the underlying nerve damage continues to get worse. While you feel a little less pain, your nerves are still starving for oxygen and nutrients. They are still dying. Wait and see, while taking medications, is just waiting for the damage to become permanent. We specialize in a different approach. We don't want to mask your symptoms. We want to help your body actually repair the damaged nerves. Let's talk for a minute about the invisible danger. Research shows that peripheral neuropathy can be even more dangerous than we think. Because neuropathy dulls your sensation, it can actually hide the warning sign of other life threatening conditions. Imagine having a heart attack but not feeling the typical chest or arm pain because your nerves aren't communicating correctly. Or imagine stepping on a tack and walking on it for 3 days because you couldn't feel it, leading to a massive infection and eventually amputation. This isn't meant to frighten you without cause. It's meant to show you why early intervention is critical. Early diagnosis and treatment gives you the best chance of stopping the progression and reclaiming your life. There really is a breakthrough in healing nerves. At Aniana Neuropathy Center, we excel at treating the root cause of neuropathy using the cutting edge MLS Class 4 robotic laser. This isn't your average cold laser or simple heat lamp. This is an FDA cleared state of the art technology designed specifically to stimulate healing at the cellular level. Think of your damaged nerve cells like a dead car battery. No matter how much you turn the key, mask the pain, the car won't start because it lacks energy. The MLS laser uses a process called photobiomodulation. It delivers specific wavelengths of light, 808 for anti-inflammatory effects and 905 nanometers for rapid pain relief. The light energy acts like a battery charger for your cells. It stimulates the mitochondria, which is the powerhouse of your cells, to produce more energy, which in turn increases blood flow to the damaged area, decreases swelling and inflammation, and accelerates tissue and nerve repair. It's a lot like building muscle through weightlifting. You are providing the stimulus that triggers the body's natural regenerative processes. Our patients absolutely love it. We know that medical treatments can be intimidating. That's why we love the MLS laser. It is completely non invasive. That means no pain, no drugs, short sessions, and safety first. No pain because most patients feel nothing at all, or perhaps a light, soothing warmth. No drugs. You don't have to worry about the brain fog or dizziness associated with neuropathy medications. Sessions are short, treatments are quick. They usually last 20 to 25 minutes. Our laser is robotic, meaning it delivers precise, consistent doses every time. We use strict safety protocols, including protective eyewear, to ensure your session is effective and safe. We specialize in difficult cases. We've seen patients who were told there was no hope and that they would just have to learn to live with it. One of our patients says, I was at the point where I couldn't drive anymore because I couldn't feel the pedals. After a few weeks at the Aniana Neuropathy Center, I have the feeling back in my feet and I am back on the road. Dr. Dailey and his team gave me my life back. Pretty awesome. We pride ourselves on providing expert care that treats you like a person, not a chart number. We want to see you back on the golf course, walking with your grandkids, and living life without fear of falling. We're so committed to helping our community fight back against neuropathy that we're offering a special evaluation package. We initially scan your feet looking for structural abnormalities. We do a neurological exam to determine the severity of the neuropathy, a consultation, and then a full-blown laser treatment. It's normally $297. We're doing it for a limited time for just $97. We do have 13 vouchers available this month. Are you ready to find out if your neuropathy is reversible? Are you ready to stop masking the pain and start the healing process? Step one is take our free neuropathy severity survey to see where you stand. There's a clickable link on this webpage. Step two is simply call our office to claim one of those 13 vouchers. The phone number as well is here on the webpage. But I look forward to meeting you personally and helping you get your life back.